Hi, my friends. Another disease can be found by echocardiography is VSD. VSD, ventricular septal defect. Ventricular septal defect, VSD, a hollow in the heart, is a common heart defect that's present at birth. It is congenital. The defect occurred in the wall or septum that separated the heart lower chamber, ventricles, and allow the blood to pass from left to right side heart. Because the blood pressure in the left ventricle up and bigger above from right ventricular, the blood flow goes the left LV to RV and overload in RV, and this overload goes to lungs, and we have right side enlargement in VSD. More VSD is congenital, and we can the patient have a souffle in physical examination be detected by echocardiography. In this page we see the VSD and fellow left to right, and this is the VSD in septum, and this is the VSD in septum. In echocardiography we can detect this VSD, the VSD. In Doppler we have a flow about left to right. If the size VSD is small, we have increased flow about 4 meters per second, but if the VSD is bigger, the flow is smaller. So in picture we see the VSD, large VSD we see, and when we Doppler continuous Doppler, we have a smaller wave from the small VSD, because in a small VSD the speed of blood is higher than when the VSD is larger. So one of the index to know what is the size of VSD is the phenometry by Doppler. If we have a high speed wave, we can say the size VSD is smaller about the when the speed of blood is lower. But in echocardiography we can sizes the between the wall and this wall. For example, we can sizes the end of wall and the size VSD. And we see this is a large size. VSC. In this picture we have a large VSC. We have this VSC is paramembranous VST near the aortic valve, and maybe the VSC is the muscular VST. The muscular VSC is better about the perimembranous VST, because this VSC can destroy the aortic valve, and we must check the aortic valve about AI. For example, in this VSC is muscular VST. If the size VSC is small and we can observe the VST, but in large VSC we must be operated by occurred this. This is the VSC jet. And this is the VST jet we measured by Doppler view. The first view we must find the VSC is long axis, but in short axis and four chamber we must find the VST, but in long axis is better view, the best view to find the VST. Because more VST is congenital, we must find another congenital disease near the AST or PS, or another congenital disease in heart. In old men, after MI, maybe rupture the septum, and we have a non-congenital VST. So in old people, when the septum have an aneurysm on dyskinesia, we must detect the VST and by color and Doppler echocardiography. In a small VSC, we can observe the patient, but when they have a operation and surgery, we must prophylaxis, give them prophylaxis for infection in VST size. Checking out valve is important in VST, paramembranous VST, because it can destroy the aortic valve, and the patient give a high AI, severe AI, and the complex in heart. So the cardiologists write about the VST in conclusion, and the size VST left to right shunting, and Doppler jet VSC, and have a thrombus on VSC size in right the end of conclusion of echocardiography. Goodbye.